Hi, I'm Dr. Denise Albano, and today we're going to be talking about lung cancer screening. Lung cancer screening is so important because we can find things early, and when we find them early and they're small, we can cure them. Years ago, we used to do chest x-rays for lung cancer screening. Back in 2015, there was a national lung cancer screening trial done with over 50,000 patients. So what they did was they took half the patients had a chest x-ray, half the patients had a CAT scan. And what they found that if we use the CAT scan as the screening tool, and we use a low-dose CAT scan, less radiation, just a small amount of radiation, we can find the smallest little lung nodule, 2-millimeter nodules, or sometimes we find no nodules at all, which is great. And this can save your life. With lung cancer screening, we catch early stage cancers. When it's a stage 1, when it's fixable, before you have any symptoms. If you're thinking, should I get screened for lung cancer? If you're at the age of 50 to 80, you've smoked for at least 20 years, or about 20 years, and you quit less than 15 years ago, you should get screened for lung cancer. There are other risk factors that are also important to mention. If you have World Trade Center exposure, radon exposure, asbestos exposure, silica, having emphysema, things like that, and family history. These are very important. So if you have any of these risk factors, you can be a candidate for screening. So as you might know, other cancers like breast cancer and pancreatic and colon, they all have blood markers. You can go into your doctor's office and get a blood test, and they can see if there's any markers that are floating around. But unfortunately with lung cancer, we don't have that as of yet. So we rely on imaging. That's why it's so important to get screened. Here at Stony Brook Cancer Center, we have a unique program. We have a multidisciplinary team that will care for you. You might be wondering what to expect when you call our office to get screened. So when you call, we'll talk about getting set up for a CAT scan. This is the low-dose CAT scan. If you've ever had a CAT scan before, you know how simple and easy it is. But if you haven't, it's very easy. You're going to lay on your back. You're going to go through a big wide tube, so if you're claustrophobic, do not worry. You're going to be zipped in and zipped out. The procedure is less than 10 minutes and we don't need any contrast. So you might be afraid to get screened because you're afraid we might find something. The good news is, if we do find something, usually it's a very small nodule. And from there, we follow it, we see what needs to be done, depending how large it is, and we talk about what to do next. And finding it early is the key. Finding a stage 1, a small little nodule that you don't have any symptoms for, this can be cured. Lung cancer screening is a fast, simple, painless process. So get screened today. It can save your life.